The Ghana Health Service has indicated it is tightening and reviewing existing measures to avert further outbreaks. In a statement released by the service, it hinted it is collaborating with the Ministry of Health and other stakeholders to monitor the country's specific measures to address current threats of COVID-19, especially with respect to importation. Excerpt of that statement reads, there has been a decline and sustained low levels of COVID-19 cases in Ghana over the past 3 months. However, the change in the global situation, particularly with reported increase in new cases in China and other countries, as well as Ghana's relatively low vaccine coverage, poses a major threat of importation and a new wave of COVID-19 infections. The situation calls for the tightening and reviewing of existing measures to avert further outbreaks. We will shortly come out with our country-specific measures to address the current threat of COVID-19, especially with respect to importation. It further states that we want to use the opportunity to encourage all Ghanaians who have not availed themselves for the COVID-19 vaccination to do so. Those who have taken the first dose are to go for second dose, and those who have taken their second dose are also entreated to go for the boosters. Vaccination remains the best protection against COVID-19 infection. Signed by Director General of Ghana Health Service, Dr. Kuma Boaje. Now joining us via phone is Dr. Franklin Bekwe, who is Director of Public Health. I'm grateful for your time, Mr. Franklin Bekwe.
Thank you very much. So my name is Siedu Bekwe.
Yes, sir. Mr. Siedu Bekwe, thank you so much for joining us. So you say that you are monitoring some of our COVID protocols so that you come out with specific measures. What specific measures are you bringing out this time to deal with this pandemic, which is showing up again on the global village?
Thank you very much. Let me say our release is an approach to allay the anxiety and the fears of Ghanaians. So, because of the perceived or the threat going around the globe, we have met and then we have agreed on a number of measures. So we have like general measures and a specific. I think that our release is talking about the general measures. The specific, as was clearly stated, will be communicated very soon, maybe today or tomorrow. So I am not speaking on specific measures. What I want to put across is that you see where we are now is not the same as where we were in 2020. So the issue is not just about the importation. We also have cases within the country. So our focus, should not always be on importation. So in trying to address COVID, I would say it's an attack and defense. The attack is the importation, which I say that we are going to come out clearly with our specific measures. But there's also a defense part, which is the vaccination. And that's why we talk about the fact that Ghanaians should get vaccinated. I think that basically that's what we want to do. And we need to put across that the global space, so if you look at the data across the world, you can see that there are cases all over. I mean, UK, US, China, South Korea, Taiwan, they are all getting cases. So it tells you that you need to get yourself protected, and that's the way of vaccination. And I think that's the way we wanted to come to the Ghana.
Some countries are beginning to restrict countries that they believe are infected. For instance, China, they are bringing very severe restrictions to people who want to enter their countries from those areas. Are we going to do the same?
So as our statement said, we will come out with a clear country-specific measures. And that will include things like that. But what I'm saying is that for now, you see, no matter how the attack is, if your defense is very good, you can avert all of groups. So for a start, we want to push the idea of Ghanaians getting vaccinated. And we don't want to run away from the fact that we need to be protected against the virus. The specific measures will come, I think maybe today or tomorrow. But first, as a service, what we are crucial about is the vaccination rate. We are saying that we have not been able to achieve what we aim to achieve. Ghanaians should get vaccinated. We have a reasonable number of vaccines in the country, and that is for us to go for now. The importation measures will come maybe today or tomorrow. But I think for us, it's good that we communicate to Ghanaians that for the past several days, we have been engaging our stakeholders within and without the country, trying to be clear what measures we put in place to minimize importation. And that one will come out very shortly.
Dr. Asedo, I'm grateful for your time. He is the Director of Public Health, and he says that between tomorrow and the following days, they will be bringing strict measures or specific measures to deal with the COVID spread. Still